Hey guys, welcome to Brain Trash. This is the podcast where we get to break down the system that many of us are struggling with in mental health. So today we're going to talk about autism and autism diagnoses and the gatekeeping that can happen around finding out that you are autistic and having that official diagnosis. There's lots of barriers that we have been deep diving on since our first episode. So we're excited to share that with you.
Brain Trash is very happy to participate in this year's edition of Podcasthon.
I thought it would be a great place to start with what's the story about why we decided to kind of like deep dive on this episode?
Well, I mean, I think that there's like a shitload of stories, but in general, what I usually experience is like if I'm talking to a patient about autism and we're doing gold standard screenings that I am trained in, that I have, you know, really, really worked hard to become competent in, and, other resources that are available through legitimate different professional organizations to screen for autism. I have heard from multiple sources that like it's strange that our practice does autism evaluations, or oh well, there's no way that they could do that as psych NPs, or just a lot of huge doubts and skepticism about us working through this with a patient, instead of just saying like, oh, no, you probably just have like a mood disorder because you can make eye contact. So there's a lot of stories behind that, and of which I am mostly salty about every single one of them. Um,
For being really professional about talking about them, because like if that had happened to me, I feel like I would be getting more cease and desist in my mailbox. But it's a lot of physicians, a lot of psychiatrists, a lot of just really salty psychologists. You guys, for real, other people can be trained in this. And let's be honest, we are autistic. We fucking understand autism as parents of autistic children who are autistic ourselves with autistic spouses. I will guarantee you I probably know more about this shit than you do.
Well,
In
and
the
there's
nicest way. Cease and
there's
desist.
such a big industry behind this, and so my thing that I've always wondered since day one is, what's the reason? Why? Because there's never just like a one reason answer to something like this, but what's the underlying purpose for gatekeeping? Is it nefarious financial shit? Is it just legal implications? Is it training? Is it like, there's so many different things it could be. And so I'm just constantly scanning through research and articles and updates and laws and policies to try and figure out what's the fucking point of saying, hey, you can like assess, diagnose, rule out differentials for literally everything else in the DSM. But this one, nope, they need to go pay somebody $6,000 for the gold standard assessment, which is the ADOS that I am properly trained on and highly competent in. So
Yeah, and I mean, that's the thing is it's the only DSM diagnosis that requires $4,000 to $6,000 to receive that diagnosis, which is fucking insane, right? You could pay $300 and get a full evaluation of everything else in the DSM, but not autism. So let's look at who's benefiting, right? Let's start. You mentioned the ADOS. Let's start with the ADOS. Talk to me about the ADOS and the trash that it is.
I mean, here's the thing is, when you're looking at the ADOS, there's so much that happens within that assessment that is highly contextual, right? This is all context bound of that day and that observer's evaluation of you, right? A lot of it is based on point systems that are like, how many times did you engage in reciprocal conversation about a thing? How many times did you miss an idiom or a metaphor? How many times did I bid for a connection with you and you didn't respond, right? It's very dependent on the evaluator being highly in tune with recognizing those things in nuanced ways, not just, hey, was it obvious that you didn't make eye contact with me?
Right. And
And
it's like one of
so,
the things too with like caregivers in the room for kids. If the caregiver's in the room and the kid is comfortable with the caregiver, they might have a completely different presentation than they would with that evaluator alone,
yeah.
right? With adults too, like are we masking? Are we not masking? Lots of things in the ADOS.
Well, and high performing adults who are the people that are typically seeking diagnosis in adulthood because they weren't, flagged as kids. Those are the ones that are going to be able to have more conversational abilities in a really scripted way. And so being able to suss that out is important too. And so, yes, ADOS is like one of the gold standards, but it's not a magical autism detector for everybody, right? It still is very much like there's research about high IQ individuals, high masking individuals, gender diverse populations, all of these humans outside of, straight cis white men, essentially,
Or boys,
who
little
can like
boys who like trains, right? Little boys in trains.
heavily script and pass ADOS, even if their entire lived history, developmental history screams autism, right? So it's not something that is 100% of the time going to suss that out. But if you look at like the specificity of the test, right, it'll say like, oh, this is highly specific and highly standard. And like, yes, for one certain population. And
Yes.
so even that research doesn't necessarily pull in the full context of that. It's also an observational tool. It's not a developmental time machine, right? So if somebody is a poor historian or doesn't know about their childhood, or their childhood was highly traumatic, and so they have framed those memories very differently, or they are no contact with their parents, which, as we know, a lot of neurodivergent humans right now are no contact with their parents, depending on
Political views.
context. And so if that developmental history is weak or minimized or whatever, the ADOS alone is completely insufficient, which is why most reputable clinicians should be using more than just that, right? It's not like, hey, we're just using that as the gold standard, but it's a piece of data that can provide helpful context in some cases, but is not across the board this great magical thing that we talk about it as. And it performs differently across populations. Like there's research for that. It's not an opinion of mine that is true. It's actual data. So IQ, language level, co-occurring conditions, trauma, OCD, ADHD, all of this can overlap and skew ADOS scores.
True. And it's like, even we're talking about adults, but also for kids, right? When I had to go get my daughter tested at 2 for autism, we went to a psychologist and I was freaked out beforehand because I know that they do the ADOS. She tests as gifted and she's highly verbal at 2. She was speaking in full sentences. So when I went there, I was panicked. And the psychologist looked at me and she was like, I read her profile and I just think that she's going to not show as autistic on the ADOS, but I'm going to do it anyway. But she's just not going to show up as autistic, and literally passed it, didn't show as autistic for anything, but then had to go to the bathroom and started hitting herself. And I was like, that's the most autistic thing you could have done right now. Thank you, girl. Yes. But that's kind of like the perception of a lot of professionals, is that the ADOS is the gold standard and it should no longer be, is the thing, right? Like who's benefiting by keeping this as the gold standard when this is a very outdated tool based on what we know about the research? It's continuously used, and people are saying, well, we need to have diagnosis by a psychologist, by a psychiatrist, or a developmental pediatrician. Not even pediatricians, not psych NPs in most states, not accepted, specific to Arizona, specific to many other states besides Minnesota and Michigan. But who's benefiting, right? The ADOS, the trainings for the ADOS, let me tell you, are thousands of dollars. To buy the ADOS kit, thousands of dollars. And if you have another toy instead of the ones that are in there, it no longer counts. The test is invalidated. It needs to be exactly from the ADOS, right?
Yeah.
That company is benefiting like fucking insane. That is so much money to invest in. And like, no wonder why people want to charge tons of money for it, because like, that's where it's starting.
The overhead of it all. Yeah.
It's insane. Yeah.
Yep.
Yeah. So the ADOS itself, the company is benefiting. Who else? The insurance companies, right? They get to limit how much they're paying out in resources. If they're like, well, I'm not going to pay for an evaluation unless all of these things are in it. Insurance companies are going to benefit from that. ABA companies, early intervention, because only very specific kids who need high intervention, early intervention, occupational therapy services are going to pass, I don't know, the flag is autistic, and they're going to make a ton of money off that shit versus having the diagnosis for kids who don't.
Yeah. Well, and the like standardization language in any diagnosis or treatment realm in healthcare is all based in what's my reimbursement going to be? How can I make that reimbursement higher? What can I market and bill as in order to make the most money? And so when people are having to pay not only for the training, for the materials, the marketing, all of this stuff, now they've got this like gold standard label on their training. And so they're able to bill at those higher rates and get more reimbursement and, charge more out of pocket if they're self-pay and that kind of stuff. So the financial incentive there is glaringly obvious.
Yeah, and it's like, for us, we can do evaluations at $300, right? And we can go through everything in the DSM, $300. But then when we started doing autism evaluations, I poured like a loan into it and so much money. We started doing them at about like $2,000. And since I've been able to kind of like pay off the loan, now we've cut it to 600. A lot of people will say those diagnoses are trash, right? Because you could pay $3,000 and get something more extensive, even though you, my friend, are an expert. We are experts in this. We're invalidated because like we're charging less. But who's losing when we're charging less? It's the people who would otherwise be charging thousands of dollars and making money on people.
Well, and at the end of the day, the people who are losing are the patients.
Yes.
They're being mistreated, misdiagnosed, they're being invalidated, and oftentimes creating narratives within their own identity that they are crazy, gaslighting themselves, have whatever myriad of other million diagnoses they've collected along the way, instead of understanding themselves and being able to change the way that they exist within the world and in their lives.
Yeah. And I was just thinking too about we have a group chat for our private practice and we kind of talk about different situations that come up. So one of our providers was talking about how she had a patient that went for an autism evaluation and this kid is super autistic. That is the underlying concern. And they were like, well, almost, but not really. And it's like,
Oh, this happens all the time.
did
I
we
hear
use an
this all.
ADOS? Like what? Yeah. And
You
it's like,
almost meet the threshold for criteria. It's like, which threshold is that?
yeah, it's
Are
like,
we using DSM criteria, or are we using the
mhm.
screeners, the ADOS, the scoring from those and saying, "Well, it didn't go over, this much, so you don't have it." There's no test. There's no biological marker. There's no like, "Hey, once we get this blood test back or this brain scan back or this screener score, then it's diagnosed." It's a comprehensive evaluation paired with developmental history, functional impairment, all of this stuff to bring that all together. And so, like, to tell somebody, like, oh, you almost meet criteria, like, give a better explanation of that.
Yeah, and, like, I think about too, like, the type of people who evaluate in the evaluations I've done. It's like, is that person doing standardized questioning where they're asking the question one way and then moving on, right?
Mhm.
Because so many autistic people will interpret the question literally and not give me an answer, or they're not thinking, like, into, like, nuanced situations. So it takes me sometimes 10 minutes to get, like, into the depths of,
Yeah.
like, okay, where is the corner where this applies?
Yeah.
Because it does apply somewhere and I know it.
Yeah.
But not everyone does that. They're kind of like, "Oh, no, they would have answered and they would have known it." And it's like, "No."
Well, I think some of what I've found in that space too, of like, because I've had a lot of people, like providers who have shadowed me and stuff, say, well, the way that you ask the question is really interesting. And this is what makes it helpful. Right. And so I always want to be like, I don't want to say doubting myself, but I think being unchecked in that space is dangerous. And so being able to evaluate myself and how I show up to these is important too, which is some of the nuance that I think they just think that psych NPs are incapable of doing. But I always want to avoid having confirmation bias, right? I don't want to just be, oh, I'm always looking for this. And so this is what I'm going to see in everybody that I talk to. And I'm going to ask enough questions to validate my hypothesis, basically, right? I mean, this is what we see in the news currently, just gaslighting by saying enough things to validate what you think is true. And
Mhm,
so I like to avoid presenting things that way. And I think we talked about it in that episode that we did about the autism, DSM criteria, all of that in a relatively overview way, but really being able to assess these things out in an atypical presentation, right? And without it being like, oh, here's how I'm gonna just essentially confirm something that I don't actually have evidence for. So I always want to be careful of that. But I think that that's where people leverage like, hey, well, if you're that thorough with it, you're really just projecting that onto that person. So,
yeah, and I mean, like, when I feel like it's tricky too because a lot of what therapists and kind of like psych NPs go through, I'm not really sure about how much training pediatricians get specifically in autism diagnosis. I know that FNPs get trash for anything mental health diagnosis, and same with like pediatric nurse practitioners. But like, as far as that, the school systems are not set up to help us with questioning and understanding that specific diagnosis. So it kind of sets us up for failure in a way. And I can understand the concern from professionals who did get tons of training, psychiatrists and psychologists. But yeah, I think it kind of sets us up for failure unless you've like deep dived on it, really done the initiative to train yourself and how to question.
Well, yeah, I think that any type of provider, no matter what their training, should be able to identify their own gaps in knowledge and communicate that with patients so that you're not just like, oh yeah, I know this shit and you don't know this shit, right? That's an important part of being an ethical provider. So I'm not saying necessarily that everybody should just go out and start diagnosing autism whenever they suspect it if you don't have actual training and you don't feel confident about it. But I think that the gatekeeping that's happening is very motivated by some of these, I don't even know if it's like ill intent from the actual providers, but the systems that we work within are very much perpetuating this because, as you said, training wise, in a lot of NP programs, like it's not, nobody's getting ADOS training. Well, I shouldn't say nobody. Maybe there are people who are getting training in this within school. But for the most part, this is going to be post schooling. You're going to get this specialization, this training, this additional credentialing, whatever. And so I think the reason for this is because when we look at actual state law and legislation and policies and stuff like that, I'm like, I had pulled up the Arizona policy just to kind of, I mean, I look at it periodically just because this is the kind of shit I do for fun. But I mean, the statute in Arizona says autism is diagnosed by a psychiatrist, neurologist, licensed psychologist, or developmental pediatrician who has expertise in diagnosing autism. So while this doesn't necessarily explicitly mean they're saying like fuck NPs, we're not listed, right? So like
They are.
what's the reason for that? I don't know. Is it just outdated? Is it, do they truly feel that we shouldn't be? Whatever. It's kind of reading between the lines there. But then when you look at the Department of Developmental Disabilities within Arizona, it refers to that statute and says, it shall not accept for the purpose of qualifying diagnosis for funding, right? Psychoeducational evaluations in the absence of a diagnostic evaluation as outlined in that statute. So it's referring back to the statute that does not list NPs. And so I think this is where a lot of people are like, ooh, hot stove, don't touch it because we're just not listed,
Well, personally, I did want to touch it because that's who I am.
Yeah.
So I emailed DDD several times very angrily. And like there is a program in Tucson where NPs can specifically get 2 years of training to become diagnostically competent, right, for autism. So like I like linked this program to DDD and I was like, so if I complete this, will you accept me? And they said no. I was like, bro. But then like when you look into why, you can kind of start to see that like, okay, they're trying to control how many people are going to be enrolling in their programs. How much money are they having to shell out? They're going to keep it real predictive. And soon as NPs are able, there's more access to care. Currently, there's massive wait lists to get an autism evaluation. Like developmental pediatricians for the last 10 years in Arizona, there's like 2 or 3. And like to get in line for that person, it's a long fucking time. It's hard to get an autism diagnosis and they make it hard on purpose because they don't want to fund shit out for you.
Yeah.
That's what it is.
Yeah. Yeah. The American Academy of Pediatrics lifetime cost of education, health, and other service needs for an individual with ASD ranges from $1.4 to $2.4 million, depending on whether he or she has any co-occurring intellectual disabilities. And like they're even saying like they are in support of pediatricians diagnosing this if they're specifically trained, right? And so they also highlight in this report and their updated guidelines on this of like, hey, it's probably about cost. Nobody wants to shell out the money. So instead, we'll shell out the money to keep these people institutionalized, unemployed, or really struggling to maintain employment, all of the myriad of fucking consequences of living with undiagnosed autism.
Yeah. In California, we have something that's called a regional center. So the regional center is program for under 18. It's like early intervention from 0 to 3, and then from 3 to 18, they have this system where like, if you have a qualifying diagnosis, which it's hard to fucking get for real, barriers everywhere, then you can go ahead and get services. They'll get you a Medicaid waiver, they can get you respite, they can get you like money for social things. And people are hurting to get into this program because like, as you said, it costs a lot of fucking money to raise a child and to like support them through all of this stuff. But like, California is throwing out all this money to support, but are other states like Arizona going to do that?
Well,
No.
and here's the thing. They'll say that there are programs that are embedded in our communities for this. However, I have people who do actually have, and the statute that I read is from the qualifying diagnosis thing you were mentioning, right? Doesn't mean that it's illegal for us to tell somebody, hey, you meet the criteria for autism, right? It's just like, these are who get to get the actual funding.
Services, correct. So this is coming back to the state, coming back to policies, and it comes back to too the government. Why are they throwing a fucking pissy fit about so many people being autistic? They're like, oh my God, the registry, it's the vaccines, it's this, it's that. Bro, you just don't want to pay money. Like that's all this is coming down for is money for you guys. Nobody gives a shit. You think RFK gives a shit about your autistic kid? No, he was snorting coke off the toilet. That's what he was doing.
And the thing is yes, there are these systems embedded in our public school system. However, when what this actually translates to for like truly qualifying diagnosed kid in a public school setting is that they're, even if they're gifted, they're placed in a special education class where it's mainly behavioral interventions. Hey, you're really bored because we're teaching you jack shit about anything. And now you're in this class with peers who have intellectual disabilities who do need that type of intervention. And you're frustrated, you're bored, you're pissed off, and you're acting out. And so the reports going back home are like, oh, your kid is doing great academically because we're giving them way below grade level stuff, but behaviorally they're a nuisance, they're bad, right? And these kids are assigning to themselves these labels of like, my behavior is bad, I'm a bad person, that kind of stuff. And so the systems that are embedded are not doing anybody any favors, and all of the school systems are getting defunded anyways. So like, you know, it's like we can't use the argument that we do have structures in place because we don't truly. When we look at the actual efficacy of those systems, I don't see anybody in real practice benefiting from those.
No, and it's like when we look at the system as a whole, how it's designed for neurotypical people, and that's why neurodivergent people are struggling so much. If we acknowledge the fact that so many people are actually autistic, so many adults, I genuinely, in my conspiracy theory, I think it's 1 in 4 people. I just fucking think that. That's my thought. If you start looking around you, if you're autistic, I bet all of your friends are autistic. Like, that's just my conspiracy theory. But if it actually came out and imagine like 25% of people were autistic, the entire system of 9 to 5 work of like these, you know, you have to go to work and sit in an office and you're going to do all of these things, all of that would be dismantled as soon as we start acknowledging that. So like, do billionaires benefit from neurodivergent people being, no, you know,
Well,
owning yourselves? No.
that's the thing. And I think even within psychiatry, like when we look at a level 1 autism diagnosis, right? Are these people functional? Yes. The reason they experience a lot of distress is because of the systemic structures that we have in this world currently that are unsustainable for somebody who just doesn't function well in those systems, right? And so what this does is it scares people to hear stuff like 1 in 4 people might be autistic, right? And I want to say it's so different in literally every single thing I can find. It's like 1 in 54, 1 in 59, you know, there's so much differing shit. But when we really zoom out and say, what is this about? It's also, in I guess my own conspiracy theory adjacent to yours, is that we don't need to medicate autism. And so big pharma doesn't profit, pharmacies don't profit, insurance companies don't profit as much. And really this puts more work on us as the provider to say, hey, dude, I'm not going to like chemical ABA you by just medicating the shit out of you. Let's talk about your sensory sensitivities. Let's figure out how to get you more supports. Let's figure out what things really do fucking irk you and how we can better manage that without saying, hey, you're fucked up. Here's a med to make you a zombie, you know?
Yeah, dude. And like just being in child psych for so many years, I look back and I see kind of the chemical ABA where it's like, let's just sedate and get them to function through school. And like for adults, let's take these supposed people with borderline personality, depression, anxiety, treatment resistant, everything, and just over medicate them when it's truly autistic burnout that's causing like the suicidal ideation. And like there are not enough providers who understand this and know about this and feel comfortable differentiating depression from autistic burnout. And that's not the fault of anybody. And I'm sure there are people listening who are like, yeah, I've been hospitalized. I figured out it was autistic burnout. Yeah, dude. I think there's just a massive gap, and that gap's there on purpose.
Yeah, absolutely. Because I mean, if we were to like open up the window of ability to diagnose this, to assess it, to treat it, to intervene, and more so from my perspective, I'm talking about in older kids, adolescents, and adults, because there are systems in some ways that are more geared towards doing this in young kids.
Yeah.
But if we were to do that more readily, as you said, it would kind of dismantle some of these structures within our society. And we would have to, I don't know, develop compassion for
Oh,
humans being the way that they are and allow for some rest, relaxation, ability to not show up to work 80 hours a week, things that are just not great for the capitalist machine.
the bootstrap thing, it wouldn't be like, let's pull them up by the bootstraps. Yeah, dude, I don't know. And like, aren't they like disqualifying autistic folks from the military? Because now we've got some things going on where they're going to be like, no one's allowed to be autistic. There are just so many different, there's just so many different aspects of this that go beyond my provider didn't want to give me the diagnosis. It's your provider has an entire system that's pushed down on them and almost brainwashed them to a point. So, I mean, if you are a provider and you're listening, not your fault. There are ways that you can learn about this and kind of be open. And I think the first thing is just to kind of like accept that the system is broken and it's designed in this way on purpose to hurt people and cause compliance. It's more of a compliance thing than anything else. Compliance and money.
Yeah. Yeah. Well, and I think as providers, especially if you feel helpless in this arena, or not necessarily even uneducated, but just, hey, there's so many barriers, it overwhelms me to even look at it. Making sure that when somebody comes to you and says, hey, I think I might be autistic, I've been seeing all this stuff, or I've read some things, and this is what I'm thinking, to immediately say something, which I hear a lot. Oh, but you make eye contact, so you don't have autism. Like, no, we have conversations all the time. There's no way that you're autistic. Avoid blanket statements that are really invalidating, and stay curious about these things so that if there is a chance that you have a patient who could, I don't know, thrive on less medication and more self-acceptance and learning about their sensory environment and going to occupational therapy and things like that. I mean, what a win, right? Being able to give somebody their life back by having the language to describe why they felt the way that they felt their whole lives. Even on the CDC website, it says something about like adult diagnostic stuff is still in the works. And we know that diagnosing in adulthood can be really beneficial for folks who were missed as kids and can now kind of understand themselves better, right? So there's on all fronts this language that suggests, hey, we should be looking for this. And so if we're not looking for it, we're doing our patients a disservice. We're likely misdiagnosing them with things, mood disorders. Borderline personality disorder is a huge one because the
criteria is like overlap.
meltdowns, outbursts, that kind of stuff is huge. And so knowing kind of the nuance between the things is really important too. I could fucking talk about that all day long. I won't go down that rabbit hole. But showing somebody that you care about the experiences that they're reporting, the experiences that they're having, and whether or not we actually land on the formal diagnosis or not, being able to show them that the patterns that they're recognizing within themselves matter and that they're gaining insight and understanding of themselves, which is what we want for our patients. That's the goal, is to get them to a place where they do have distress tolerance, no matter what their diagnosis is, where they're able to like live inside their own fucking noggin and not lose their shit all the time, right? Like being a human in the world is hard enough. And so having language to describe why we feel the way that we do can be such a game changer.
Yeah. I think like the TikTok thing too, a lot of providers on our Facebook message boards get really agitated when people are going on TikTok and finding diagnoses and bringing it back to them. Why does it make you so mad? There is a bias there that you need to question for yourself. Why is this making me so angry? Is it because I don't know about it? Is it because that I'm threatened because they're looking this up? But when you understand autistic people, you will understand that we like to hyper focus and we like to deep dive on things. And when you can finally feel understood by watching something, that's incredible. Be like, I didn't know other people did that. I never knew that was a thing, right? Like I made a video on crossing your toes. Dude, it got like 7 million views and people were like, I cross my toes too. I'm like, okay,
Not me sitting here with both of my big toes crossed.
I thought I was the only person that ever did that. Like it has to be done. It's like that proprioceptive input.
Yeah.
But like people don't know. They're like, I'm just weird. And we need to be open when people come to us and they're like, oh yeah, all these quirks. I crossed my toes. If I just said that to a provider, they'd be like, what's your fucking point? Are you weird?
Yeah, exactly.
But we need to look at those things. So there are ways that you can integrate things into your practice. We integrated a sensory screen recently. It's an evidence-based sensory screen, and we put it forward to every single new client. And that helps my my NPs kind of like take a look at the whole of here's the depression screening, here's the mood disorders. Wow, those are like screening very positive. But then they look at the sensory piece and they're like, man, that thing is loaded with sensory issues. And then they can think back to maybe they answer those other questions very literally. Let me have some curiosity for autism at this because they're screening really high in the sensory piece. Let me get to know that. Is that the culprit for the anxiety and kind of like all of this feeling overwhelmed? Could that be it? And they can walk into that evaluation and have more information. That's something that anybody could do. That could
This
be
is a huge one that I do with OCD as well. I love to look at the sensory screener when somebody scores really high on the Y box or an
yeah.
OCD screener, because if somebody is like, hey, I have this thing I have to do every single morning so that I can get ready for my day, but then I look at the sensory screener and it's like fucking interoception, high sensitivity to like tactile input, right? I'm asking questions that are more geared towards like, what is it about that morning routine? Is it about the way your socks feel or your clothes too tight or they don't look or feel right? Instead of just being like, oh, and so you scored, 20 whatever on the Y box, and so you have OCD, without going any further into like, why are we doing these things? What's the driving force behind it? So it can be really beneficial to just give yourself more data right off the bat so you kind of know where to take your clinical interview. And again, even if you're not somebody that feels comfortable with being able to say like, hey, either I think you should go get a formal evaluation or, hey, let's look at the risk versus benefit of acting as if versus doing the full thing, is documenting these things in your note, not necessarily for you to be able to diagnose, but so that, if and when that patient goes and gets a formal evaluation, you have a documented history of developmental social differences, sensory stuff, restricted interests, rigidity in different routines or rules or social justice, the functional impairment that these things have, right? This person not being able to get out of the door because they can't not try to make their body feel not gross before they leave the house, and all of the differentials that you have considered and why you feel that they aren't necessarily your top suspicion, so that that person has that context so that they don't have to then try and ask the same million questions and end up in that same invalidating loop for this patient that's already explaining these things to you.
Yeah. And like on that, like the OCD part, especially, if you have patients or you have OCD in general, start looking at, is this truly OCD? If it is truly OCD, there needs to be a dystonic, ego dystonic component, meaning that these things do not give me joy. This is against my will, essentially. I don't want to be doing this. I have to do this. For people who are autistic, we want to do things because predictability. Let me line things up because like it's predictable and it feels good. That's not OCPD if it aligns with everything else in the autism world, but that could be a signal of something else. And I think that a lot of these people get thrown into OCPD, which I'm kind of feeling my own conspiracy that this doesn't really exist and it's autism. But yeah, there's so many things too. As DSM-6 comes out, it's like, what's going to get shifted away? What's not going to get shifted away? Is it autism? Is it going to be grouped together? But it would be my hypothesis that the DSM will make autism harder to have and it will make the criteria significantly more difficult to qualify for.
It's funny that you said that because 15 minutes ago in my brain, I was thinking, like, I got to ask her this question about the DSM-6 because I've seen lots of hearsay about, like, what it is and is not going to be, right? And my concern is that with the things that I'm really working hard to help people manage better and support themselves better with, I would say it falls mostly in the category of level 1 autism, sometimes veering into the level 2 framework, but that this could essentially be kind of like erased as like
I
a,
think
oh, that's normal, it's fine, it's not a diagnostic. And that way all we're identifying in a diagnosis would be somebody who has a co-occurring intellectual disability or visible developmental delay, right? And so this is something that I think could cause erasure or
yes.
invisibility of people who do actually suffer and do actually have functional impairments. And so that's my concern there.
And it's one of those things where, like, if we erase that, if level 1 is erased, right, and it no longer is listed as a disability when it is in fact disabling at times, my kids being level 1 pre-board because they qualify for a disability, because if they didn't, it would be a shit show. We get ability access at Disneyland because they need it. It's not a question. It's like we don't go if that's not happening. But what happens to the adults and the kids who then would be erased out of the system of having a disability? They would just be suffering in the school. They would be suffering in everything would be removed from them. So who's benefiting is all of these places that no longer have to pay for this shit, the state. And then all of the other systems can be like, let's do intensive therapies. Let's re-recommend everything else for these higher acuity things. Yeah, dude, it's fucked to think about the DSM-6. It makes me kind of sick to my stomach. I want to see who's on the committee, and then I'm gonna shift my opinions. I bet they're all Trumpers.
I mean, I have some hope that there's like at least some diversity within the committee. And I've seen a couple things that I'm like, God, I hope that there's just a little bit of a voice of people who look at historical DSM information and printed materials and say, hey, this is why this is fucked.
Yeah. And I mean, what is the benefit if you are diagnosed with this or of a provider to diagnose somebody? So let's think about how that could how would that change somebody's life to have the diagnosis? Because what we're looking at is, oh my God, they're on TikTok, like this is horrible. How dare they? But if they receive that diagnosis, whether or not it's official DDD, et cetera, if there is like a level 1, high functioning, high masking human, I hate the word high functioning, but high masking
Right.
and integrated into me from childhood.
Yeah.
But what would be different? So we know that CBT doesn't work for autistic people. So like, let's stop fucking recommending CBT to them. Let's look at like doing OT. Let's look at IFS. Let's look at parts work. Let's look at DBT. Those are things that work for autistic individuals. Other things do not.
Yeah. I mean, there's so much that opens up once you have the right language, right? And I primarily see this in the context of people who have kept themselves locked in these boxes of either bipolar and or BPD, because the language that supports within is that, you know, I'm bad, I'm wrong, I have this thing that essentially should make me afraid of my feelings and second guess myself at every turn and not lean into some of these things that kind of flag as bad, right? So if we've historically had these big meltdowns, but now we're diagnosed BPD, it's like, oh, well, now I need to start watching out for like self-harm and I need to tell my therapist I'm using my safety plan, right? But if the self-harm is like I hit my head on the wall, right? Like something, I guess, less stereotypical. But if it's seeking sensory input, figuring out, hey, that's actually a thing that could be really supportive for me. And instead of saying I can't do that thing, figuring out a way to do that thing in a way that actually meets that need without it causing harm, right? And so what it can do to have the language and diagnosis of this is to shift the way that somebody thinks about themselves and how they support themselves, and also the types of services they seek out, not just within a therapy realm, but also in at work, right? It's not necessarily I need more anxiety meds because everyone in my office makes me so fucking nervous and then they're on a shitload of SSRIs. More so asking for accommodations. Hey, can I get a standing desk? Can I get can I wear loops? Can I have these other accommodations that are fully covered, even without an actual like official ASD diagnosis, for any type of mental health complaint that you can write into ADA accommodations for somebody and say, hey, they would really benefit from these things and here's why. And then simple fixes like that instead of completely changing neurochemistry or, you know, exposing somebody to more side effects from more meds could make a world of difference without those negatives.
Yeah, and it's like looking at, you mentioned the head hitting, but another example that would be like more common might be like hair pulling, trichotillomania, skin picking, nail biting. A lot of these, I can't stop doing these things. We pathologize and put people on medication and they're like, it's not stopping. It's no, because that's their regulating system. They don't have another system to replace it with. So we have to look at what is behind these behaviors. Is it like I'm picking my skin and I get into this loop of doing it and it's just kind of putting me in a zone and I chill out? That's a stim. And there's a lot of things that we're trying to extinguish stims without understanding that's what they're doing. And then you mentioned the job thing. I've had patients who are like, something's wrong with me because I tried to work this like convenience store. I tried to do this customer service job and everybody's having fun and they're doing it. And then like, you know, I'm at Subway or whatever, I'm making a sandwich and it should be easy, but I'm having a hard time and I'm feeling panicked. What's wrong with me? This is a dumb fucking job that like anyone should be able to do and everyone else is doing just fine, but I can't do it. And once you can take a look and say, oh, it's because I'm autistic, you can be like, oh, maybe I shouldn't do that shit. Let me pick another job.
This is always like the most brilliant humans that are like, they could open their own fucking sandwich shop if they could,
Yes.
get everything aligned in one way and actually follow through. So it's not somebody who is incapable of making a sandwich, right? It's somebody that you're looking at going, okay, functionally speaking, you have the skill set, the knowledge, all of this, but it's so overwhelming.
Yeah.
And we've already kind of treated and stabilized all of just the generalized anxiety and this, that stuff. We can look at it and say, okay, this isn't checking out. And what is it about this that feels so distressing to you?
Yeah, dude, I was the person. I was the person who was at Walmart and I had to quit after 6 months because my manager berated me because I wouldn't sit in front of Walmart at the front and say, "Hello, can I clean your glasses?" Because that was crippling to me and I didn't understand why at 18. So like they pushed me out because they were like, "Man, you suck. What's wrong with you? This is the easiest job." But like fuck you, I want to practice now. And that's kind of where it comes in is if you find your niche and you can find like supports for yourself and understand like I can't work for people because I have authority issues and I have authority issues because I'm autistic. I could be a great entrepreneur and a great boss, but I suck at being an employee. And kind of being able to look at those things about yourself and like own them, that benefits somebody. That could change their life to understand that, you
Yeah.
know?
Yeah. Even sitting down with people who have really struggled in a professional sense, who are highly masking and highly intelligent humans who have lost employment for whatever reason or just got to a state of burnout and like couldn't show up and had to take leave or something like that, to be able to watch the way that they feel about themselves change when you say, hey dude, here's your skill set, here's why you're fully capable, and here's how you could work for yourself, here's how you could structure that in a way that you slowly transition to that so it's not overwhelming, right? And to watch them be like, oh shit, you really think I could do something like that
Mhm.
is so cool. Because I think a lot of times the labels and diagnostic boxes we put people in, what they do is they limit their view of their own capabilities and they limit their view of what is safe and not safe or viable and not viable for them in a way that sticks with them for life if we don't dismantle that and look for, hey, what is the actual underlying reason we feel this way?
And I think like the thing you're saying right now is too like if we are telling somebody you are depressed and that is your problem, that is much more limiting than that's like saying you have a disorder, right? Versus you're autistic. This is something that like you have been born with and you have like survived through and you have walked through life like this and this is something that is not going to go away. It is not treatable versus depression which is treatable. You're sitting there waiting for your meds to work. So once we tell someone like, yeah, I think you could be autistic, maybe like just own that self-diagnosis, that is the point where they could be like, okay, I'm different and that's okay. And it's not going to go away. Medication's not going to fix me.
Well, and being able to zoom out on that specifically at that situation, I get that all the time in clinical practice. And it really is like I will zoom out with them and say, hey, dude, let's talk about depression because that's really fucking big, right? Yes, there are criteria for that. However, is this depression rooted in like, hey, dude, I'm fucking disillusioned by the pattern recognition of what's happening in our world. And I think about it every single day. And I think, hey, if we would just, I don't know, give a fuck about other people and do things fairly and practice social justice, maybe we wouldn't be in the position that we're in, but people love money and power and all of that shit, right? And this is the spiral in their brain. And eventually you have to get to a place of recognizing if you are, high IQ, high masking, whatever you want to call it. If you get to the end of that spiral, it's always going to be there's no single thing that I can do as an individual human to change that. And there's no way I'm going to be able to get all of these people convinced that there's a solution to this because it's so nuanced, it's so binary in how we're viewing it right now. And so it just becomes really frustrating. And that, like, I give up, it all sucks. That's usually where I find the depression in my autistic individuals.
Yeah, and I think that's kind of the start to the burnout too. Like we could
Mm-hmm.
do a whole episode on autistic burnout and like what that looks like and kind of walking through that and what's the solution. That'll have to be its own episode. Maybe we'll
Sure.
do that next. We could do autistic burnout
Yeah.
next. Um, but yeah, I think this is kind of it's an important topic and I'm hoping that people can listen and say, okay, I'm going to at least open my mind to this. In whatever way, if you are the person who is doing the self-diagnosis, like, okay, let me just own this and hyperfixate on it for a minute and like deep dive and like just feel it and like own it. Or if you're the clinician, maybe just stop being such a gatekeeper, bro.
And
Learn
just stay curious.
more.
Like, I don't think anybody, well, I shouldn't say anybody. Sure, there are absolutely diagnostic places or just, disorders that would lead people to want to be a part of a group that they are not actually a part of. However, I would say the large majority of humans coming to you saying stuff like this have done a shitload of their own research. They have spent a lot of time considering this, and they've been very scared to say it to you because most people who come in and have said this before have gotten a really invalidating response. And so it takes a lot of courage for them to get to a place where they're willing to say this to you and that they trust that you won't be somebody that does that. And so at least receiving this concern from them in a way that's respectful and validating and not even necessarily like, oh yeah, absolutely, I'll diagnose that for you.
Yeah.
But more so just like, oh wow, I really love that insight. Let's look at that more over the course of time. And we can kind of come to a conclusion together as we move through navigating how you show up for yourself, and
Yeah.
really teaching those like sensory strategies or giving them information and resources on where to find that if you don't know that. I would highly recommend learning about how to support your patients in sensory ways, executive dysfunction support, since we're highly comorbid with ADHD, social burnout stuff, like how do we pace ourselves? How do we set limits, boundaries in ways that still allow us to feel that we are living our moral, those rigidity structures that we have, but in a way that's sustainable long term. And then those accommodation letters, obviously, we can be a part of that part of the solution, even if we don't have a diagnosis, to just say, hey, this person has a diagnosable disorder that qualifies them for ADA accommodations at work, and then writing it for them.
Yeah. I mean, that could be like the game changer. So, anything else you want to add that you can think of? Last words?
I can think of a million other things, but no. I'm like, I think every single one of my remaining thoughts would spiral into its own episode. So,
I mean, we can do that. Okay, so final words for me. We recently launched a foundation for Arizonans to have mental health care covered. So I'm just going to like plug this shit here. We are paying for autism evaluations. We are paying for sensory gear for people who otherwise cannot afford it. It could be weighted blankets. It could be anything. It could be OT services, like all of the things that would be financially a barrier for folks who do not have insurance. This could be like funding an evaluation for autism for someone who has to, shell out the thousands of dollars. Like we can support that. And that's what this foundation is going to do. I'm taking no salary from it, but if you would check out paperflowerfoundation.org and consider donating, consider sharing, consider like volunteering. We have neurodivergent shirts, which are actually pretty cute. We've worked pretty hard on them. They're 70s vibes coming up soon. So consider doing Shop for a Cause and getting some cute neurodivergent shirts that also support getting neurodivergent folks mental health care and medications. Thanks for tuning in, y'all, and we'll have another episode up soon.